Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Hello everyone, welcome. This is Dr. Jacobs. In this video, I'm gonna go over how to stop tendonitis pain. But before we do that, we're gonna understand what is tendonitis and the risk factors for having tendonitis, and then we'll go over the steps that can be taken to stop tendonitis pain. So first, what is tendonitis? So tendon is actually a cord that that connected the muscle to the bone. You can see it here in this image, and this is the tendon. The white part is the tendon and the red part is the muscle, and you can see the tendon here. Right in here you will see the tendon that attached to the muscle. The muscle is the red part. So any muscle has to have tendon to connect the muscle to the bone. And when you start to have tendonitis, any word ending with itis, it's always inflammation. So tendonitis is inflammation in the tendon area. You can have it anywhere in the body. So like in this image, you can see here in the shoulder, if you have tendonitis here, you will see inflammation, swelling in the tendon area where the tendon attached to the bone. So typically you will experience pain, and usually patients describe it as a dull, aching, especially with movement when you move your joint. And it's very tender to touch. It depends on how bad is your inflammation. So causes and risk factor. One of the main causes that actually trigger or causing tendonitis is repetitive motion, like throwing, extensive kneeling, leaning, on the elbow. So sports injury, of course, that could be a risk factor too, or cause involving repetitive motion. If you overdo it without enough without like enough warming up or cooling down, or overtrain, that is increasing your risk of having tendonitis issue. So you can see it here in the knee. That's where you have patella tendonitis. This is the kneecap here and the tendon here, and when you start to have inflammation, you start to have swelling in the tendon area. But it's not only swelling. I will explain to you in the next slides. And here it's another common tendonitis in the elbow, when you start to have like tennis elbow or golf elbow, inflammation in the tendon that attach the muscles to the tendon here. So how to stop tendonitis pain? So before I will go over what you need to do to stop tendonitis pain, we need to understand the normal healing cycle, because when we understand normal healing, it's going to be very easy and simple to work on the tendonitis pain. So I'm going to use external paper cut for visualization, but the same cycle happen internally, but we don't see it. So in the first image, the first stage of healing is inflammation. As you see here, swelling, redness, the blood start to rush to that area, and you start to experience pain and decreased function. And that's very classic with tendonitis. You start with inflammation, but when you start to having tendonitis issue, usually happen after repetitive motion or repetitive like a strain that actually cause micro tear in the tendon area, and that's when you start to have those tendonitis issue. The second stage of healing is a proliferation stage. That's when the body starts to build the scar tissue. If the body does not build the scar tissue, actually it's going to be open wound susceptible for infection. So actually we need that scar tissue, especially when your tendons start to have micro tear. If your body does not build the scar tissue, that tear will never going to heal. So we need that. So think about the scar tissue as like a glue that actually glued the teared tissue. During the stage of proliferation, there is a cascade of events like fascial restrictions, muscle spasm, trigger points. I'm just gonna focus on the scar tissue for the sake of our time here, but I have other video about, I covered the fascial restriction, muscle spasm, and trigger points. So perfect scenario actually during the maturation stage, that's when it's healed. Your body actually gonna get rid of the excessive scar tissue and everything clears up as you see in this image. Why scar tissue could be an issue? Because our muscle should act like a rubber band. When it contracts and relaxes, it should stretch like this. So when you have a scar tissue, it's like you have a knot in a rubber band. So when your muscle contracts, it will not stretch much. So you start to lose range of motion. And that's exactly what happened with tendonitis. When you have a micro tear in the tendon area, your body starts to build excessive scar tissue. So it's shortening the muscle length, and you will not be able to stretch it much. That's why when you actually extend your joint, that could trigger the pain. And as you can see here with the tendonitis, you start to have inflammation, and also you start to have a scarring here to heal that teared area. So to treat really tendonitis, we have to address the healing cycle. So if you have inflammation, we have to really take care of the inflammation. At the same time, we have to break down the scar tissue, release the fascial restriction, muscle spasm, to be able to get to maturation stage. For someone who has really chronic inflammation, chronic tendonitis that's been for a while and has not been addressed properly, they're usually going back and forth between inflammation and proliferation, and that's a vicious cycle. And in order to really break this cycle, we have to work on inflammation and proliferation simultaneously. So I want you to remember, it's never tendonitis only. It's not only inflammation in the tendon. You usually have a scar tissue in the tendon area, and usually happen also in the muscle area. So, and you start to have muscle spasm and trigger points. So really, to address the root cause of the problem, we really need to work on everything on this vicious cycle. So what's currently used to treat tendonitis that is not very effective, like ice or heat. Ice is temporary decrease inflammation. When we look at the healing cycle, it's not going to do much for the proliferation. It's not going to break your scar tissue, fascial restriction, or muscle spasm. So that's very temporary. Even the study proven that. Electrical stimulation is the same thing. Temporary pain relief does not address anything in relation to inflammation or proliferation. So it's basically masking the symptoms. Another non-effective approach is foam roller. So based on the study, is actually there is no long-term effect for foam roller. And it's actually just if it's inflamed, you're gonna rub over the inflamed area and you're gonna make it more inflamed. So the other thing that's used commonly is massage. But think about this way, if you have severe inflammation here and you rub it, you're gonna inflame it more, you're gonna cause more scar tissue because your body has to go to the proliferation stage again. And based on the study, does not really provide a long-term result. And the other thing is we have to go deep to the area of the tightness if you have like a scar tissue or fascial restriction. And mechanically is impossible with the hand to really go deep to release the tightness. The other thing that's been used very commonly, and I have video on it, why you should not actually stretch, because stretching causes more inflammation. So think about this way. If I have tendonitis here and I have a scar tissue and I overstretch, you actually could cause more inflammation. Actually, study shows overstretching will cause inflammation. And if it has not been healed properly and you overstretch, you could cause more tear or snap it. So that's why I don't recommend the stretching. There is other safe approaches than the stretches. Strengthening exercise, it's good to include that, but you want to include it on the right time. You don't want to do a strengthening exercise when you have a lot of inflammation that causes more inflammation. So we introduce a strength exercise on the right time. So how to treat tendonitis? First, we need to focus on each stage of healing. Like for inflammation, for example, you need to stop the repetitive motion that causes it. So for example, if you are a plumber or someone does some work kneeling, the kneeling will cause patellar tendonitis. So you really need to avoid much kneeling or put a knee pad. So we want to refrain from the motion that constantly cause more inflammation in that area. So usually, if you are in acute stage, it should take 3-5 days. If you stop the repetitive motion that actually triggered the tendonitis, should be enough to really get your inflammation under control and your pain under control. If the 3-5 days has not been effective enough, that's an indicative that you have a little bit more inflammation, moderate to severe inflammation, and you have to be aggressive to decrease the inflammation. One of the things I do is I use a MagnaHeal. This is a very strong magnet. The magnetic field is around 3 inches deep that can penetrate the body. That will help with decreasing the localized inflammation. The other thing I do, especially if someone on an inflammatory diet, that's gonna slow their body to healing. Usually I put them on anti-inflammatory diet because based on a study, if you eat refined carb, refined sugar, that put your body in inflammation for like 5 hours after eating. So we want to make sure your diet is not causing more inflammation. For severe chronic tendonitis that actually not healing very well, that's an indicative that there is a chance of vitamins, mineral, or hormonal imbalance. Because for inflammation to move to proliferation stage, you need to have magnesium, B, C, D. There's other vitamins and minerals that if you have deficiency in, your body not gonna transition to proliferation stage. You're gonna be going back and forth between inflammation and proliferation, and no manual maneuver gonna replace your magnesium deficiency, for example. So for chronic condition, I usually check if there is other deficiency. One of the options that you can take advantage of is Ask ASTR. It's a free online medical evaluation. It takes about 5 minutes, and the software is actually built based on at least 9 healthcare provider database to check your nutrition, your cardiovascular diseases, your endocrinology system. So it's a very comprehensive evaluation to really figure out if you have deficiency, what the possible deficiency you might have. So make sure you take advantage of that if you have chronic tendonitis. So this is basically to address the inflammation. Now, at the same time, we need to work on the proliferation stage to break this vicious cycle. So I divide the proliferation stage on 3 categories: scar tissue, trigger points, and fascial restriction. And I will just briefly go over these here, but I have really very comprehensive video on it, just to give you understand how important we have to work simultaneously on all of these. So for scar tissue, I use the A3 tool to break the superficial scar tissue, and we use it for the scar tissue. And I use the A5 to really go deep, to really work on the deep scar tissue and also deep trigger point. And that's why I said massage is not very effective, because it's impossible with your knuckle, with your elbow, that's what we learn in the school, to really go deep in the muscle or a tendon to release the scar tissue. It's impossible mechanically to go with the hand. So that's why I invented this tool to really go deep, and it can go deep up to 2 to 3 inches in the tissue to do deep release. So that's what I use to break the scar tissue. Scar tissue, you have to have mechanical force to release it. So if your massage or foam roller superficially outside like this, you're really not getting there to cause physiological change. So the second thing we have to work on is fascia. Briefly, I'm going to go over that because it's extremely overlooked by a lot of healthcare providers, because there is not a lot of proper training on it and effective treatment for it. So fascia, the superficial layer of fascia, is like a web that covers the entire body. It's like a Spider-Man suit. You can see it here in this image when we do dissection. That's the white web tissue here. That is the fascia. So the superficial layer is actually wrapping the entire body, and we have layer wrapping each individual muscle and group of muscles, and each individual fiber, and each individual tendon too. So to make it complicated, but the treatment is not complicated, we have 2 big categories of fascia: superficial fascia and deep fascia. The deep fascia divided to 4 subcategories fascias, and when you look at those lines, each category of those fascia layer has actually 2 to 3 layers. That shows you how complex the fascia system. You cannot pick and choose one layer and ignore the other layers when you treat fascia, because if you do that, you're really not treating the whole system. We have to release everything. So it sounds complicated, but the treatment extremely simple. So let me show you the fascia here in the body. So you can see it here. The operatic fascia is usually wrapping a group of muscle. Here you can see the epimysin wrapping the whole muscle here, and the epimysin wrapping a bundle of fiber, and you can see it in this image here. And you start to see the endomysin that's wrapping in each individual fiber. So when you have fascia restriction, it's like you wearing a t-shirt 2 to 3 size too small. You're gonna feel like it suffocates the tissue. It's compressing on everything underneath it. And for tendonitis, the fascia layer that's wrapping the tendon, usually with tendonitis, it's gonna be shrinking or tight, that compressing on the tendon, and your body builds the scar tissue in that area too. So we have to release it at the same time. So the way I release it, I use the A1, and I use that to release the superficial fascia restrictions, and also the first layer of the deep fascia. And with the A5, I usually release the deep fascia layers, the epimysin, the premiysin, the endomysin. It's very easy, simple to use. Most of patients can do it at home on their own. So to wrap it up, how to treat tendonitis, we have to base it on the healing cycle to really get to the root cause of the problem instead of just addressing the symptoms. So first thing, you need to stop the repetitive motion that causes tendonitis. If it's in acute stage, that should be enough. 3 to 5 days should be enough to really get the pain under control and get back to normal. If you're not back to normal in that short period of time, that's indicative of you having either mild, moderate to severe inflammation, and your body going back and forth between inflammation and proliferation. You need to be aggressive to address the issue from both stages of the healing cycle. If you kneeling, you need to wear a knee pad. If you're using your elbow a lot and putting pressure on your elbow, that's part of your job. You need to have protective pad or something like that. So that's another way to decrease the risk and prevent having more issue in the future. But if you have moderate to severe inflammation, I usually use the MagnaHeal, the anti-inflammatory diet, and figuring out if you have deficiency, what kind of deficiency you could have to help your body to transition from inflammation to proliferation stage to maturation stage. So, and at the same time, you have to release the scar tissue, the fascia restriction, the trigger points. As I mentioned, you have to have mechanical force that go deep enough to do that release. If you don't have mechanical force to release those issues, it's like you are a mechanic and you need to unscrew a screw inside the motor, but you are using a short screwdriver. It's not gonna reach there. You will never be able to unscrew that screw. So make sure you really get something to be able to go deep, and those what I use the tools, the ASTR tools, to go deep to release those tightness. So that's how to treat tendonitis. If you have any question or comment, make sure you leave it in the comment section below, and I will see you soon in the next video. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below, or go to asterinstitute.com.